Thank you, Karen, for the lovely introduction. I'm Sean Latanzia with Montgomery County Local Behavioral Health Authority, and I'm here to talk about community mental health services for children, adults, and adolescents. Okay, who is the Local Behavioral Health Authority? Well, we're part of Montgomery County government under Department of Health and Human Services, Behavioral Health Planning and Management and Crisis Services. The Director of Health and Human Services is Dr. Raymond Krall. The LBHA is responsible for planning, managing, and monitoring the public mental health system at the county level. We have numerous county contracts that deliver mental health services as well as substance use services. Today, we're going to talk about when do you think you need additional services from the local behavioral health authority for children and adolescents as well as adults? Okay, so one of the things I want to talk about is assessing when a child or a teen might need additional service beyond therapy, and they might need some in-home based therapy and mental health services. So when we look at this, we look at when are the higher level services needed to keep a child safely at home. So sometimes a child may have a high risk for suicide, but if they got additional in-home services, they may be able to maintain safety at home. Also, we sometimes provide additional in-home mental health services for parents and caregivers who are unable to access resources due to their own mental health or substance use needs. As well as when a child has a significant trauma history, additional mental health services may be able to access them to help them remain safely in the community. Also, when the parent or caregiver is overwhelmed by the child's significant mental health needs, at these times, families need additional services to help them maintain safety in the home. One of the services that we can start at, we're going to talk about services from, I guess, a continuum of not the least amount of services, but the services that provide some supports all the way up to services provide maximum and residential supports. So let's first talk about the local care team. The local care team is comprised of child serving agencies in Montgomery County. And those agencies are Child Welfare Services, of course, the Local Behavioral Health Authority, Department of Juvenile Services, Montgomery County Public Schools, and our Family Federation for Families. We also have, sometimes we have some other programs that sit in and observe the local care team. We generally meet on Wednesday mornings, and parents can refer their child to the agent for the local care team, or schools or therapists or hospitals also refer children to the local care team. And the local care team is operated by the Collaboration Council, which also has a subcontract of wraparound services, which is provided by Jewish Social Service Agency, or JESA. In the local care team, actually, we brainstorm and we look at different services that might meet the child's needs and where the child is at this particular point in time. This could also include teens, and soon it will include transition age young adults as well. So what'll happen is the families, we get together, we meet, we have a referral either from, like I said, from the schools or from the parents. There's no income limitation or insurance requirements to access programs. Sometimes after the LCT, families are able to engage in other programs or refer to programs such as the county wraparound or family navigation, which assists families in looking at different services throughout the county. And we can also recommend a higher level of care. Referrals, like I said, can be made directly to the Collaboration Council, as well as parents can self-refer to the program. At the end of this presentation, my phone number and email address, and I can also send you referrals and applications as well, more additional information on all these processes. The next one is Interagency Family Preservation. And this is an in-home program that provides significantly more hours than what the county WRAP does, even though wraparound sounds like it's more of a wraparound 24-hour program. This is more of an interagency program that provides a short-term amount of hours, usually a couple hours, 4 to 5 hours a week, sometimes up to 8, and they can do some in-home intensive work. And they can also provide care coordination, which is similar to case management. Basically, they work with a child who has identified needs, and they also work with the family to help the child be safely maintained in the home. They also have a network of referrals and providers to also assist with the family to help the child remain safely in the home. And again, referrals for this particular program, IFPS or Agency Family Preservation, can be made through me. Our next level of service is the 1950 State Amendment Plan, or Targeted Case Management. This program is operated through a care coordination organization. And this is Volunteers of America Chesapeake. And they have offices in Montgomery County, Prince George's County, as well as Baltimore County. And this program provides an additional set of services in targeted case management, as well as they can provide an array of other kind of services if child meets the criteria, medical necessary criteria and financial criteria. They can provide additional services such as respite care, mobile crisis support, and care coordination. And to really, depending upon if you'll get transit TCM or targeted case management, will really depend upon what the eligibility level of the child. Referral processes directly from the care coordination organizations, but I too have applications for this program and referral forms, and I can assist you with that as well. But the one condition on this program is the child does have to have medical assistance. Our next program, which is our probably most intense, is Care Connections for Families, the Intensive Home Crisis Stabilization Program. This is again for children ages 4 to 17, but we are going to, hopefully, we might be able to serve children a little bit older if necessary. The provider is Shepherd Pratt, who is now Family Services. And again, this is an in-home stabilization program. It's also to reduce the risk of psychiatric hospitalization. So if a child is at risk of hospitalization, and if they got some in-home services at the home, we might be able to safely maintain the child at home with an in-home stabilization worker and a therapist, which works on stabilizing the child. We also have children sometimes that are discharged from residential treatment centers, as well as after post-secondary psychiatric hospitalizations will enter this program to help stabilize the child. The short-term program, generally 2 to 4 months. Children can be referred to this program. Children and youth can be directly referred through the Crisis Center on a case-by-case basis. The LBHA or me can also identify children and send referral forms in for the Care and Connections program. Our next highest level is what we call the Reich Evaluation Unit. And the LBHA is able to assist and help children and youth, basically children ages 12 to 17. And this is a program that actually does extensive psychiatric educational and psychiatric evaluations in a residential environment. It's generally, most days are 90 days, and they'll outline a treatment recommendations, and sometimes they'll also work with the school side of things. The LBHA can submit community referrals only for the Reich Evaluation Unit. There are other diagnostic evaluation units around the state. Those basically go through Child Welfare Services. Also, if you want and interested in the Reich Evaluation Unit, you will need a clinical letter from a psychiatrist or a psychologist recommending that your youth needs this type of service. The highest level of treatment is residential treatment centers, or RTCs. These are children with complex who need residential services to treat their behavioral health needs. And generally, children have a medical necessary criteria, and generally that includes children who must have multiple psychiatric hospitalizations. They're at high risk for suicidality or homicidality, and children who need the services generally stay in these residential treatment centers anywhere from 6 months to a year and a half. And school was also an important component of this program. They go to school, and they also have the residential and clinical services all on one site. For a child to be admitted to this high level of services, they will need a certificate of need. And a certificate of need is basically a con and requires a psychiatrist saying that the child or youth needs an RTC placement due to their medical necessary criteria, and that the youth is at risk of self-harm. Also, a therapist will also need to give a social history and recommend that the child or youth needs a RTC level of care. And also a physical saying the child's not at risk is healthy enough to be in an RTC level of care. The RTC process can be lengthy, and we do assist in the process. We do sign off on the forms for children to go to RTCs, but generally most RTCs processes or the con documents a lot of times go through hospitals, and sometimes private psychiatrists can make the recommendations as well. And we work closely with Montgomery County Public Schools as we go through the RTC process. So the education piece would either be paid for Montgomery County Public Schools, Child Welfare, or Department of Juvenile Services. When we get to transition age youth, that's generally for youth that are over 18. And we have a couple different programs for young adults, generally 18. Sometimes they go up to 26, but we do the residential rehab programs are actually the providers are Cornerstone Montgomery and Shepherd Pratt Family Services. And these are residential programs that are, or young adults can stay in these programs through their transition age years. They have to meet medical necessary criteria set forth through the Behavioral Health Administration. And they provide supportive housing, but it's an independent living program, but staff are available 24/7 for the young adults in the program, but they don't provide one-on-one assistance. That's a really important distinction. When you get to the adult world, it's much harder to get one-on-one supports. But again, the medical necessary criteria is generally individuals who have a behavioral health need, and that can meet medical necessary criteria. And there's more information about the residential rehab programs can be found on the behavioral health website, and I have that link down there, as well as psychiatric rehab programs are also important part of day programs for transition age youth. And generally folks, young adults could go to a residential rehab program as well as a psychiatric rehab program as well for their day services. Now, there are also mental health services for adults. The Access team is kind of the one-stop shop for adults. They can screen, they can make referrals to all sorts of and linkages for individuals living in Montgomery County and might not have insurance or on the public mental health system, and they can make referrals to a variety of services as well as targeted case management for adults. And the Access team is the contact number is right there, 240-777-1700. All right, and if you have additional questions for adults, I really encourage you to go directly to that number, and they seem to have there seem to be the one-stop shop for that as well. So my information is here, Sean Latanzio. I'm with the local Behavioral Health Authority, and my email address as well as my phone number. So if you have additional questions, again, you'll have to write them down in the chat box. Thank you and have a nice day.